This is Michael Jaff for Viva 365. I'm joined by three experts to give us unique perspectives on the future of very important controversial topics in vascular disease. Let me start with my colleague John Laird. John, talk to me about drug-device combination products in PAD.
Well, it's an exciting time, Michael, now with the publication or presentation of the Levant-2 and Medtronic Impact SFA trials. Hard not to be excited about drug-coated balloons for femoral popliteal intervention. Certainly drug-eluting stents continue to play an important role here, and then very exciting in the near future, hopefully, to see bioresorbable vascular scaffolds that elute a drug into the vessel.
Excellent, exciting time. Let me jump to John Kaufman. John, tell me about how we're going to think about the management of pulmonary and venous thromboembolic disease.
So, Michael, I think we're going to break this down into acute and chronic. I think the acute, we're well along the way for both the pulmonary and the peripheral venous thrombosis to be more aggressive, to clear the thrombus. There are a lot of strategies, a lot of technologies out there that are looking like they're going to be really beneficial for patients. I think what's coming up behind an even larger reservoir of patients with chronic disease, I'm thinking mainly in the lower extremities and pelvis, but potentially even in the lungs. We may be able to deal with some chronic PE issues non-invasive or minimally invasively as opposed to pulmonary thromboembolectomy. I think we're going to see a huge interest and growth in interest in treating these patients more aggressively.
Excellent. And Kenny, talk to me about what we're thinking with critical limb ischemia management.
Well, critical limb ischemia is an unfortunately expanding field because there are more and more patients with it as patients live older and live longer and have more disease. So the big question is, do you handle these patients first with less invasive or minimally invasive techniques, or do you take them to the operating room? And how do you decide? I have the privilege of being one of the three principal investigators on the NIH BEST trial, BEST-CLI trial, which looks to randomize between surgical open surgery versus endovascular therapy. Two other co-PIs are Matt Menard and Alec Farber, both surgeons. And I think this will help us answer some of these questions. It won't be the end-all and be-all, but it will certainly help give us a strategy as to what's the best approach for certain patients. We also need to collect more data about these patients in a registry format, those that are not enrolled in the trial. We hope to, Viva, for example, hopes to accumulate these patients in registry so we can learn more about these patients.
Exciting times from three experts. This is Viva 365.